This is a special edition on 102.3 KRMG, Tulsa's News and Talk. The KRMG Morning News 8 a.m. in-depth hour starts now.
Good morning, 8 o'clock. Partly cloudy skies, 35 in Tulsa, warming to 61 this afternoon. Light winds today, but pretty windy and sunny over the weekend as well. We tell you the three big things you need to know every 15 minutes on the KRMG Morning News with Dan Potter. Number 3. New this morning, a teaching assistant in the Shoto Mazie schools busted when cops find evidence she's been having sex with a 16-year-old student. Jennifer Frazier also faces a charge of possessing child pornography. Number 2. Happening now, Tulsa police are investigating an officer-involved shooting happened about 2:30 this morning near 61st and Peoria. Police tell us they were out on a domestic violence call when they encountered a man with a knife. They say multiple officers and a security guard told him to drop it. He didn't, and they opened fire. We're told that man's in critical condition this morning. And number 1, our top story on the KRMG Morning News with Dan Potter. Have you talked to your family about what to do in the event of a major viral outbreak? It's a conversation some of us have had a few times in recent years. Some have seen SARS and MERS and the swine flu and H1N1 come and go, and they don't feel any anxiety about this latest potential pandemic. Either way, people are talking about the new strain of coronavirus and the disease it causes, COVID-19.
KRMG goes in depth.
Here's KRMG's Russell Mills.
Governor Kevin Stitt made a point yesterday to address the issue. He first stressed that we have no confirmed cases in Oklahoma. But then he went on to assure everyone the state has prepared for an outbreak.
The degree of risk can change quickly. And in the event the situation worsens, Oklahoma has a statewide plan in place that is operational.
I've been asking folks if they're worried about COVID-19.
What's your name?
I'm Barbara.
Barbara, and you, sir?
Bill.
Bill?
Bill told me he really hasn't worried that much about it.
Some, not real much. I mean, if it's going to happen, there ain't a lot I can do about it. I just try to keep a low profile.
Would you alter your lifestyle in any major way if cases started coming around here?
I just stay at home. I mean, I'm retired, so I don't have to go if I don't want to.
And Barbara, well, her plan runs along the same lines.
I'd keep my butt at home.
Just stay home?
Yep, sure would. Got plenty to do.
Okay. Got to go to the store at some point?
Not at this point.
I didn't really understand at first, but as Bill kindly explained, they've had long experience with preparedness.
So you're prepared for this?
Yes.
Yeah, we raise our own cattle. We got our own chickens. I mean, so our freezer's full of beef and stuff. I mean, so if we don't want to go, we don't go.
I understand your answer. So when you say we're just going to stay home, you're really set up to do that.
Yeah.
Yes.
So they have a plan, but Barbara still worries. I mean, they have family too, and she hopes folks are paying attention.
A lot of people are not taking it as serious as they should. You know, they're like, well, when the election's over, it'll all go away and all this other stuff. This stuff is killing people.
It is.
That don't just go away.
And it is. But as the governor pointed out, 11 deaths so far in the U.S. from COVID-19, about 18,000 in recent months from the flu. And good news, we can fight back against all these viruses.
Most important thing you can do is be vigilant in washing your hands, staying home from work or public gatherings if you are running a fever, and avoid close contact with sick individuals.
For Barbara, it all basically comes down to common sense.
I think people will eventually get a brain and start using it and start staying in if they're feeling bad or under the weather or something. But it'll eventually click.
And you can click on the open mic button on the KRMG app and join our conversation about the novocorona. Russell Mills, 102.3 KRMG, Tulsa's News and Talk.
Issues that matter to you, expanded on the KRMG Morning News 8 a.m. in-depth hour.
Dan Potter and Rick Corey joined in the studio by Dr. Bruce Dart, the Executive Director of the Tulsa County Health Dept, and Kelly Van Buskirk, who is the THD's Epidemiology and Emergency Preparedness Director. Welcome to both of you.
Thanks, guys. It's great to be here.
Yeah, thank you. This is obviously, it's dominated a lot of the talk and a lot of this show for the last week, and it's been around since December that we've been talking about it, but there is something over the last, I don't know, week, 2 weeks maybe, that's really accelerated this. What is it in your mind that has everybody sitting up and paying attention right now?
Well, I think when you hear about viruses or diseases that are overseas, not in this country, it's people are aware, but they're not afraid because it's not here. Well, now we know in this country it's here. It's not in Oklahoma yet.
Right.
But once it hits your shores, then you become a little more aware and a little more vigilant, and there's always a concern at that point, and it ramps up as days go by.
I want to break this down into 4 different sections over the next hour. And in this first section, really take a look at what is a coronavirus overall and how this one coronavirus is different. We had somebody earlier this week send us an open mic saying, hey, look, I've been looking at this Lysol, and it says right on here it protects against human coronavirus. So that it's not new. No, coronaviruses aren't new, right? This one is, though.
Absolutely, and like many viruses that we deal with, the viruses exist. Coronavirus is one of those viruses that can cause the common cold and rhinovirus. But these viruses genetically shift so that their DNA becomes different, and how they impact the human population then changes. So it's new; it didn't exist before. And when it's new, there's no immunity anywhere in the world to it. So that's when we, as public health officials, start to really get concerned about the impact on our human population once it starts circulating.
Yeah, no immunity, Kelly, and a lot of mystery about what it's going to do next.
Correct. Because it's a new virus and it hasn't yet affected the population, I think that's where some of the concern comes in. With it being, as Bruce mentioned, there are a multitude of coronaviruses out there, but the reason why it's a novel coronavirus is it's a new one that we have not seen yet.
And nobody has immunity to, and we don't know what the arc of it is. We'll talk a little bit later about, what you think as far as if it's seasonal or if it's something that's going to keep growing. But before we get there, we know the epicenter is Wuhan in Hubei province, China. Is there anything known more about how this new virus appeared, where it came from, how are viruses born, for lack of a better word?
Many times what we see and what the pattern across history has been is that these are viruses that start in animals and are animal specific. And then through close contact and constant contact and interaction, these viruses mutate and they jump from animals to human. And then we had the potential for human-to-human transmission is where we're at now, but that's generally there's a lot of hosts, we call them. In this case, we believe it was the wet animal market in Wuhan and the constant interaction between these animals and the close contact with humans, and they genetically shift and humans eventually become infected as well.
What about how it's transmitted? We have so many questions about, can I get it off a counter? Can I get it off of a coffee cup? We were kind of joking before. Our company did away with styrofoam cups a long time ago. I wondered if they'd bring them back to have something that you couldn't, mistakenly not wash in time. So what can you catch it from? Well, there's been some pretty good studies that shows, yes, it can survive on surfaces, but its survivability on surfaces isn't very long. So you could, but it's a lot harder. Generally, it's spread through what we call respiratory droplets or secretions, which people cough and sneeze and becomes airborne, and you breathe it in. But when it becomes airborne, it lands on the surface, which is why we're constantly telling you to wash your hands, which I'll do after I patted your table here so much this morning.
Hey, you're in a radio station. That's always a good idea.
But that's really why we're telling people that washing your hands is so critical, because you pick them up. Or you could touch your eyes and your nose and then touch something and infect either a surface or another person. So that habit of touching your face, we noted just before you guys got here, is that I just did it. I just touched my nose. How many times an hour? Is it 30, something like that the average human being touches their face? At least. If you're someone like me, it's probably more. Yeah. So it's something that we have to be cognizant of. Okay, Kelly, you're the Epidemiology and Emergency Preparedness Director. How do you break yourself of that habit?
I don't know that you can. I think it's just a normal human nature to touch your face. I just have an awareness. Again, I think to protect yourself, it's not, we say don't touch your face, but because you do it, just make sure you're washing your hands and washing the surfaces.
Add that behavior instead of trying to modify the
Correct.
I think you had the best idea. Handle jalapenos constantly, and then you just won't touch your face.
I saw the meme floating around. In fact, my ex-wife, if you don't want to sing the happy birthday song, just pretend like you got done chopping jalapenos and you have to take your contacts out. That'll make you wash your hands. Who is most susceptible, Dr. Dart? Right now we're seeing that the elderly, people with
underlying health conditions, people with immune compromised health conditions, people with heart and lung problems. So that's really been our first concern. And the way the virus is playing out, that's the demographic who's right now most at risk.
Isn't it interesting that, and Kelly, I was going to ask you about this, it seems like kids, we're hearing, are actually been pretty resistant. Is there a reason we can track that too?
I think that it's because they're the most healthy in our population. And so, they're resilient. They have a good good respiratory system. And as Dr. Dart mentioned, it's our underlying health conditions. So when you have the respiratory illness and you have the shortness of breath and the cough, that really puts a lot of pressure on your heart and your lungs. And so children normally don't have those underlying health issues. And so those individuals that do have the underlying health issues, those are the ones that are going to be most at risk.
But there's nothing like a healthy, active, running around child to carry that virus somewhere else, right?
Correct. Just because they're healthy doesn't mean that they won't get it. And we all know, we joke about it, that kids carry a lot of germs, and they are ones that don't always wash their hands as often. So if they do have some symptoms and they are touching stuff, or, we joke that they're carriers of germs. So again, they can easily spread it just like the rest of the population.
Do you think this is seasonal, or do you think this is something that'll build over the summer, or might we see it go away now and return even stronger in the fall, Dr. Dart?
In all honesty, we're really waiting to see. I mean, we definitely hope that's the way it plays out. We're hoping as the temperatures warm up, the virus penetration in the community goes down like influenza does. But frankly, at this juncture, we just don't know.
And that's another one of the variables that people need to take into account here is that we don't know.
Exactly.
Are there examples of other viruses that continue to thrive during hot weather months?
Well, if you recall, H1N1, which was our last pandemic flu, actually started in April of 2009, about the time that the normal flu season is ending, which really surprised us all. So these things do happen. We're hoping that coronavirus follows the influenza flu path, but we'll probably know more in May.
I want you both to get graphic with me here, as graphic as you think you need to get. If you read a book like The Hot Zone or The Coming Plague, and you read the description of what the filovirus like Ebola or Marburg does to a body, it essentially breaks down the internal organs and you bleed out. That's how you die. What does this virus do on a cellular level to the human body?
The bottom line is that it's got receptors that adhere to your bronchial passages. If your immune system isn't as healthy, it goes deeper into your lungs. Ultimately, it can cause diseases like pneumonia, and which a lot of healthy people will get sick, but they'll recover. But when it's so deep in your lungs, and pneumonia does result. The elderly and those with those other health conditions just can't recover. It overwhelms the body and the immune system, and the immune system basically turns on itself.
Dr. Bruce Dart is the executive director of the Tulsa Health Dept. He's joined by Kelly Van Buskirk, who is the director of Epidemiology and Emergency Preparedness. We're talking coronavirus and COVID-19 on the KRMG Morning News. We'll take your questions via open mic on the KRMG app, and we'll get to some of those in just a moment. 8:21 on the KRMG Morning News with Dan Potter. Hit the open mic button with your questions and comments about coronavirus and COVID-19.
Guys, the coronavirus is being blown out of proportion. It's no more dangerous than the flu. The flu killed 4,800 people last year.
The flu kills hundreds of thousands of people per year, and we have a vaccination for it.
People, take a chill pill. It's not as bad as the flu. Good Lord, we're gonna survive.
Honestly, I think this is gonna be like the flu when flu season happens. When everything heats back up, the flu goes away, so will the coronavirus. So people just need to weather through it for a couple more months. When summer hits, all this is going to be gone, and we won't have to worry about it.
Dr. Bruce Dart, Tulsa Health Department, and their chief epidemiologist, director of Epidemiology and Emergency Preparedness. Get it right, Dan. Kelly Van Buskirk is here. I love the number of open mics that are starting with people.
Yeah, I don't get that. Right?
Yeah, I noticed that.
And B, did you hear the number of different flu case numbers there? And I know it's probably looking at state versus nation versus globe versus deaths versus cases. All right, you guys, you heard it. How do you respond when people say this is being blown out of proportion? Is it?
You know, I love when people add context to this conversation. And the bottom line is that we don't know since we don't know how bad it's going to be. We don't know who ultimately it's going to affect. We know that people are dying a certain demographic. So while it's not circulating widely in Oklahoma now, we do know eventually it's going to be here. So what we're trying to do is to really educate people so they're aware and they're informed so they know what to do when it does come here. Because frankly, we don't know how it's going to be until it actually reaches Oklahoma. Now, it's a brand new virus. It doesn't exist anywhere else, and we're still learning how it's going to play out and how it's going to affect people. So I love that people are calm, and as well they should be. Just be aware and be informed and stay tuned to all the information that guys like you are giving them and act appropriately.
Kelly, it's your job to be prepared for the worst case scenario. Do you think that we're overhyping this in the media, locally, nationally?
I don't know that I would say overhyping is the correct terminology. I do think that raising awareness to it is a really good thing, but I do think that having a conversation about staying calm and knowing what to do to protect yourself is very important. And those are the main messages I think that we need to get out there is, help yourself, and by helping yourself, you're helping others. If you are symptomatic, stay home. Don't expose others to it. Again, a lot of people bring this up as a comparison to influenza. That's right. We have seen over 18,000 deaths of influenza here in the U.S. We've had over 50 deaths of influenza in Oklahoma. So I think, and we don't have any cases here of coronavirus. We don't have any deaths. So I do think, I think that it is a good message for individuals to be aware, know what to do, but stay calm.
But before we leave that, to their point, or to the point that's probably most important, is mortality rate from the two. And I'd seen that it had changed a little bit. Where are we right about now between the two?
Well, for influenza in this country, remember, it's a big N. It's a big number that we can compare. So we're talking about a 0.5% mortality rate. With coronavirus right now, it's about 3.4%, which is why we're a little concerned, because it's a huge difference in rates. But with coronavirus as well, I mean, let's just be honest. We have cases who are mild or asymptomatic. They're probably not counted in that number.
Mm-hmm. And just quickly, is that, I think, 3.4 mortality rate, is that higher or lower than the Spanish flu was? The Spanish flu being the epidemic at the turn of the last century that killed, 100 million people worldwide.
So it's actually a little lower, of course, but once again, with the Spanish flu, we also had that N number, that total number. We don't have this yet, so it's not an apples to apples, I think.
What you're saying is that the mortality rate could go up from this.
It could go up or it could go down. We're hoping that it goes down, but definitely when it really becomes widespread throughout this country, this will be a much different conversation.
We're continuing our conversation about coronavirus and COVID-19 with Dr. Bruce Dart and Kelly Van Buskirk from the Tulsa Health Department.
This is a special edition on 102.3 KRMG, Tulsa's News and Talk. The KRMG Morning News 8 a.m. in-depth hour starts now.
Good morning, 8:30. We have sunshine right now, 38 degrees in Tulsa, 61 for a high later today with sunshine. We tell you the three big things you need to know every 15 minutes on the KRMG Morning News with Dan Potter, number 3. Happening now, Jennifer Frazier facing 2 counts of rape and 1 charge of child pornography. Mays County authorities say the 41-year-old Shoto teaching assistant had a long-running sexual relationship with a 16-year-old student. Number 2. While you were sleeping, 2 police officers and a security guard were firing on a man with a knife at the Waterstone Apartments near 61st and Peoria. Cops say they got called to the apartments on a domestic disturbance complaint. They encountered the guy holding a knife outside, and they say they shot him when he refused to comply with several commands to drop the weapon. And number 1, our top story on the KRMG Morning News with Dan Potter. It's an 8 a.m. in-depth hour as we talk about coronavirus, the disease it causes, COVID-19, and our preparedness locally for it. Let's look at the Tulsa Public Schools. They are preparing for scenarios involving the COVID-19 virus.
KRMG goes in depth.
Here's KRMG Managing Editor Rick Corey.
The first thing to know is Tulsa Public Schools already has plans in place to handle things like this.
It's really written for like a pandemic flu kind of a thing, which has tremendous overlap into this particular virus. We have reviewed that plan. We continue to actively work with the Tulsa County Health Dept, Tulsa Area Emergency Emergency Management Agency and the Oklahoma State Department of Health and the Oklahoma State Department of Education. So there are a lot of collaboration going on to make sure that we are all coordinated, and including with the districts in our area.
So from that guidebook, in this particular case, what actions are being taken?
Making sure custodians that our practices are super tight in the cleaning of surfaces, because that's a really significant issue with this virus, keeping surfaces clean and just making sure that we have all those practices in place. We also have a tool that's like a fumigation system. We're looking into purchasing additional of those machines in the event that we need those. In the event there is an outbreak or this grows, and whether or not we need to consider how we manage our school system if we have to close schools. And so what does that mean for employees? What does it mean for learning? How would all of that work?
So we ask if that's even a possibility.
We certainly have enough devices, and we have physical tools in terms of computers and Chromebooks and software programs and things like that. What I think is more of a challenge is how many students have that level of experience with it. And an even bigger challenge for us in Tulsa is connectivity. So whether or not our students have internet access at home. And so those are things that we're looking into right now.
Bottom line, there's a plan in place, precautions are already being taken, and where we go from here depends on the spread of the virus. Rick Corey, 102.3 KRMG, Tulsa's News and Talk.
Issues that matter to you, expanded on the KRMG Morning News 8 a.m. In-Depth Hour.
Don't pop the bubble wrap. The air in it's from China.
Don't pop the bubble wrap. The air in it is from China.
Makes a point.
Dan Potter, Rick Corey with Dr. Bruce Dart, the Executive Director of the Tulsa Health Department, and Kelly Van Buskirk, the Director of Emergency Preparedness and Epidemiology. It does bring to mind, though, okay, let's say we've purchased something on Amazon that was manufactured and packaged in China. Do we need to be wiping that thing down when it gets to the house?
You know, and I've gotten that question probably a gazillion times now. And, you know, what the World Health Organization is telling us is that this virus can survive on surfaces for up to for several hours, up to maybe a day or two. So chances are, no, you don't have to wipe down everything that comes in from China. So.
All right. It's an 8 a.m. in-depth hour. We've kind of been breaking it down into knowing our enemy first and then gathering our defenses against that enemy, being the novel coronavirus, and now kind of into the battle plan. But I want to double back because we never really got a chance to go, I think, in depth on what the symptoms look like. And I've heard many times that you're going to start feeling like you have the flu. Well, every year's flu is a little bit different. Some of those attack the stomach, some of those attack the head, give you a fever, some don't. So what are the symptoms associated with infection with this coronavirus?
Yeah, and it is very similar to the flu. I mean, it's fever, it's coughing, it's shortness of breath, and those are our primary three for coronavirus. And with fever or with influenza, you would add body aches to that same list. So,
are there some adults who will have it, who will carry it, who will not show any symptoms?
What we're seeing is that we have adults who are either very mild or what we call asymptomatic, where they have no symptoms whatsoever, but yet they have coronavirus and are actually shedding virus as well. And that's part of the thing that's really scary about this.
Another thing that's scary is you may have it, you may tell your doctor about it, you may get sick and be very sick and still not know if you have it because there are ways to test for it, but there's no testing available right now, at least in Oklahoma, correct?
No, and Kelly, you want to talk about what the testing process is here in Oklahoma? Because it does exist, and the CDC has been doing it, but we have a new process now. Kelly?
Yeah. So we do have testing that is going to be available hopefully sometime next week. The testing kits are here. They are working to validate those tests. Part of that process is just making sure that the public health lab at the state can run them and they are getting the results that are expected. So when those are up and running, we'll be able to start sending samples from here to our public health lab here in Oklahoma. They will do testing. A negative test comes back as negative. A positive test would come back as a presumptive positive. It would go on further to CDC for confirmatory testing. But it will help speed up the process. So as we have pending PUIs out there right now, or persons under investigation.
Two of them, right?
Yes, we currently have two. Those individuals are self-isolating, quarantining for 14 days to not...
What part of the state are they in, can you say?
Oklahoma.
You cannot say. Okay.
No, you can't.
No, we can't. We won't release. We won't release information about people that we're monitoring. Or individuals that are PUIs and what part of the state they're in. If we were to have a positive case, we will notify the public of what county of residency that individual's in.
How quickly will they be able to turn around test results for a presumptive positive or a negative in Oklahoma City?
24 to 48 hours.
Wow.
And so, so that is pretty quick. And that's really exciting because right now it is about, it can be a 3 to 4 day process by the time we get the sample, get it sent to CDC, and they do the testing.
So let's move on to response. What does the health department do? What's the level of response if this starts to kind of pick up and grow? And where are you right now?
So, and I think this is interesting thing because when H1N1 hit, as you recall, we didn't have a vaccine right away.
I recall.
So with coronavirus, we know that there's no therapies and there's no vaccines. Ordinarily, if we had those tools, we'd be pushing those assets out. So right now, since there isn't any, and there's no way to actually treat for the virus itself, the physicians will treat for the actual symptoms. We ask patients to self-isolate and stay home. Don't go to large gatherings and really do the things that we've talked about in terms of coughing, cover your cough and sneezing. But until we get therapies and vaccine, we treat the symptoms, we self-isolate, we stay away from the actual public, and hopefully that palliative care, we call it, will help you recover from it.
Okay, I'm going to make this personal. And maybe it'll be illustrative for other people who are contemplating A, travel, and B, being around crowds, and C, being around kids. Next week, Wednesday, I'm supposed to fly to Indianapolis for the Music for All National Concert Festival, which will bring middle school and high school musicians from all over this country and from Asia and Europe, 3,500 of them, to Indianapolis for 4 days of concerts, dinners, meetings, close proximity stuff with young people. Should that event be held? And would you recommend going? And then just talk overall about travel and getting on an airplane with a group of people too.
Well, and so we have spring break coming up as well, and I think many people are worried about that. From a public health perspective, we get worried about spring break no matter what, because kids go to places where there's large gatherings. They bring all kinds of other issues with them. It's not too rare that after spring break we start to see measles cases, mumps cases, chickenpox cases. So those fears for us have always been there. Now with coronavirus, that's ramped up. So the CDC does have travel guidelines on the CDC website. I would recommend everybody review those travel guidelines because it gives you information about whether you should go to those type of events. I mean, I don't want to sit here and say that a certain event should or should not be held because that's not my call.
Right.
But at least with the CDC travel guidelines and the awareness that they give you, it helps people make decisions about whether they should go or not.
Okay.
Kelly?
I think it's important, too, to remember that the general risk to the public is low. So the spread right now is low. Yeah, we are seeing regions in the U.S. that are having some community spread more than others, but the general risk right now to the public is low.
See if we can get this open mic in before the break here.
What kills the virus if you're trying to clean a countertop or something like that?
What kind of cleaner should you use?
Any household disinfectant. So, and people use Clorox and Lysol and those kind of things, and they all work, and it kills everything.
And clean your phone.
Yes. No, you know what? We've talked a lot about hand washing and covering your mouth and all that stuff. I haven't heard anybody yet say clean your phone. That's the Petri dish right there. Yeah, clean that phone. 5-day forecast brought to you by Ferguson Subaru.
102.3 KRMG, Tulsa's news and talk, where we tell you the 3 big things you need to know every 15 minutes, all day. Now, back to the KRMG Morning News, 8 a.m. in-depth hour.
Can you ask the health people about the age group of the people that are actually dying from the virus itself?
Okay, and we've talked a little bit about the mortality rate and the fact that it's mostly elderly and people with underlying conditions that have died, right?
That's correct, yes.
But I want to caution against fixating on mortality because you don't want to get this thing, period, right?
That's correct.
A lot of people, young people, healthy people, have gotten very sick and probably wish they'd die from this virus, correct?
Yes. And I think that's what, while just because someone's not dying, all of us who have been sick in the past, how that makes you feel. Yeah. It's not a pleasant experience. So either way, you don't want this.
It's not just that. It's if you have to be at home for 14 days, if you can't telecommute from there, what happens with your job? There's a lot of ways.
There's a lot of this.
Yeah, it's going to affect a lot of things. It's not just that, right?
What is this text? Dan, local mail arrives from local utilities. Quickly, do we nuke mail or place in freezer before opening? Okay. Get it out of the freezer. You go ahead and put your utility bill in the freezer. Leave it there for a month.
And then put it in the microwave.
Open your mail and wash your hands after.
There you go.
Let's go back to washing our hands.
Thank you, Kelly Van Buskirk. Okay, we've got about 3 minutes left. We've got to talk about masks because nothing's elicited a greater response than when I talk. I'm going to cough now. Into my elbow.
Good job.
I appreciate that you coughed. You covered it.
Good job.
Thank you. All right. So I went to Lowe's last weekend looking for a mask so I could blow some dirt out of my mom's garage and didn't want to breathe the mold that I thought may have been in the garage. So an industrial mask worked great for sawdust and mold and large particulate matter, right? It never even occurred to me that when I went to Lowe's that they might be out of the things. They're out of even the industrial face mask. So, Dr. Dart, tell us why we shouldn't be out stockpiling face masks.
Thank you. I'm really glad you brought that up. I mean, people have been hoarding face masks, and they think that it will prevent them from getting this illness. Well, it actually does not. The only thing face masks really helps is if you actually have the illness, it might help you from spreading it to other people. It's not going to prevent you because most people are getting this either from droplet spread or from touching a surface that has it and then touching the eyes and nose and mouth. So masks won't help you with that.
Not any kind? I mean, is there a brand? Is there a specific, a more complete one, so to speak?
Well, there
I can hear people saying, well, then why do doctors wear them?
So there is a brand called N95, which is fitted, which we really want to save for our healthcare providers. We don't want people to go do a run on those masks.
Our frontline
healthcare providers, our emergency responders, our EMS, our police officers, our EMT. I mean, they need those masks because they don't know what situation they're walking into.
And then, Kelly, people don't use masks right when they wear them anyway, right?
No, and that's the thing. With the N95s, there is a fit test process to go through because if they are not securely on your face and to the shape of your face, there's ways to get droplets in there. The myth also is that healthy people wearing masks, again, it goes back to that how many times do you touch your face. If somebody's not healthy in front of you and coughing, droplets can contaminate the mask. You take the mask off, you've now contaminated your hands, you touch your face, you've possibly exposed yourself to some germs.
And the number of people who will wear a mask all day and then go into a restaurant and take it off, and it's kind
of
go to a
buffet, start grabbing all those handles.
That everybody's touching.
In the break, we found out that neither Dr. Dart nor Kelly Van Buskirk go to buffets.
It's a preference. It's just a preference. There's nothing against buffets. I prefer not to.
Are you saying we do?
Thank you both for being here. Hopefully I think you've calmed some people down and given a little perspective to what we're facing here. Dr. Bruce Dart, Executive Director of the Tulsa Health Department, Kelly Van Buskirk, their Director of Emergency Preparedness and Epidemiology. It's 8:54. Fox 23.